Malaria and anemia are two major public health problems for African children. In this project for the Welcome Data Reuse competition in malaria, we sought to rethink their relationship using new data sources. So childhood anemia is thought to impair cognitive development and cause many other health problems. There's evidence in individuals that malaria infection can reduce iron absorption and cause anemia, but there's no conclusive evidence at the community level about what the effect of malaria control would be on anemia. Also, anemia prevalence has been proposed as a marker for malaria control because it's easier to measure anemia prevalence than malaria prevalence, but there's not a lot of evidence on how well this works. So our goal was to look in a whole endemic region for malaria, what would the effect of reducing the malaria prevalence be on childhood anemia? And we combined two data sources. Data from the Malaria Atlas Project, which has detailed data on malaria prevalence, and data from the demographic and health surveys as compiled by the IPOMs. So one of the big challenges is that areas where malaria is high may be different than areas where malaria is low in many characteristics, and so to causally attribute a drop in malaria to anemia, we have to control for differences between the places where malaria is high and malaria is low. So we used a matching design in which so the demographic and health surveys surveys clusters. The clusters aren't the same in the early and the late years. So we created matched quadruples. There would be a pair of clusters that are in similar places where the prevalence was high in both the early and the late years, and then another pair in which the prevalence of malaria was high in the early years, around 2000, and low in the late years, around 2015. So these are three examples of the quadruples we formed. So for example, this is in Cameroon. Here's a pair of clusters nearby in which the prevalence of malaria was close to 50% in both the early and the late years, whereas it was paired to a cluster where the prevalence was high in the early years but dropped to 7% in the late years. Here's a pair where this was a pair of clusters in Burkina Faso where the prevalence was over 50% in both the early and the late years, and it was paired to a pair in Benin where the prevalence was high, 57% in the early years, but dropped to low in 17% in the late years. Here's a pair of clusters where the malaria was high in Malawi in the pair in both the early and the late years, but in Tanzania it was high in the early years, 46%, but dropped to 14% in the late years. So what this graph shows is some of the covariates we control for. For example, this is the quality of flooring material, whether the house had a toilet, whether it was in an urban or rural area. And the red and the green show that, for example here, that the places where malaria remained high in both the early and the late years, the higher it is, the better the quality of the flooring material. So the places where it remained high in both the early and the late years had worse flooring material than those where it dropped to low in the late years. But after matching, they're very similar, and that's true for all the confounders. So the matching means we have very similar places that were high versus high-low. And then we looked at what is the effect of dropping from high to low on the odds of anemia. And so this shows that the odds of anemia, if malaria dropped from high to low, were multiplied by 0.84, or that means the probability of anemia went down by about 16%. And although it's not quite significant, the confidence interval does contain no effect, but it's almost significant, and the magnitude of the effect is larger than, for example, the wealth index goes from 1 to 5. So reducing your wealth increasing wealth by 1 point on a 5-point index is estimated to have less of an effect than reducing malaria from high to low. So this shows the potential value of malaria control on reducing anemia. We really benefited from the work of the Malaria Atlas Project and the Demographic and Health Survey Group to make their data available and easy to use. We were making data easily available encourages innovative use and finding by different groups, reduces duplication of creating the data sets, and it really has a multiplier effect on good research. And we think that people should be recognized for the contribution of making data available and easily usable. We'd like to express our thanks to the Wellcome Trust for organizing this competition, and thank Wendy Prudhomme, Amir, and Ryan Simmons for their kind help and support. This is the great team that worked together on this project.